For 2 years, COVID-19 has upended nearly every part of our lives, especially difficult for pregnant women who were in the dark about how the disease and the vaccines would affect them and their unborn babies. ABC 10 News reporter Jared Aarons takes an in-depth look at how research done here in San Diego helped provide answers and reassurance.
I am due in about 2 weeks.
For Laura Holloway, the excitement of meeting her first child is tempered by going through an entire pregnancy during a pandemic.
Really scary when you've been trying as long as my husband and I did. You know, anything makes you nervous.
It's a fear shared by millions of other women around the world. When the pandemic started, doctors didn't know how COVID-19 would impact pregnancies.
I think in the beginning of the pandemic, we had very little data. And so our recommendations were based off of hypotheses and based off of theories.
But that changed when the National Institutes of Health released data in June of 2020 showing pregnant women have a significantly higher risk for hospitalizations from COVID, and that pregnant women who get COVID have a higher risk for complications like preeclampsia, hypertension, premature births, low birth weight, and miscarriage or stillbirth.
It was eye-opening. It was eye-opening that these young, healthy women do get sick and do get sick quite severely.
Dr. Joanna Adamczak from Sharp Mary Birch Hospital remembers how cautious pregnant women became. She says many stopped going to routine appointments. She also saw a drop in the number of new pregnancies. Women wanted answers about how to stay safe.
The mood in the beginning, I think, was everywhere. Fear of the unknown.
Even when the vaccine came out, it created more questions because pregnant women were not included in early trials.
The special population of pregnant and lactating women shouldn't be at the end of the bus.
To get more information, San Diego's Mother to Baby and the Center for Better Beginnings launched 2 new studies following more than 3,000 women through their pregnancies. Their work showed vaccines were safe and effective for pregnant women and their unborn babies.
Maybe a year or so into the pandemic where we started to feel like we had something to say, and now I think we have quite a bit more to say.
Meanwhile, researchers at UC San Diego's Mommy Corps, the Mother Milk Infant Center for Research Excellence, launched their own studies to see how the virus impacts breast milk. Within months, they found COVID infection does not pass from mother to child through breastfeeding, but antibodies do.
The speed is certainly amazing, and we learned a lot about this particular virus making it in human milk or not in this case. What happens to the specific vaccines that come in.
All of that gave doctors on the front lines more data to help debunk myths about COVID and pregnancy. Going forward, doctors say pregnant women will still have to be cautious about COVID. It may require masks, extra sanitizing, or even a booster shot during pregnancy. But it's something they're confident can be managed.
I think we are going to start to look at COVID in a similar way to which we look at flu.
And researchers will continue their studies. They're planning years of follow-ups to look into the long-term effects COVID has on mothers and their children.
We really want to know how your kids are doing when they're 4 or 5.
That's why Holloway enrolled in one of the studies at Mother to Baby. She's thankful for the women who took the early risks by getting vaccinated, and she hopes more women will benefit from whatever science can learn from her.
Here I am, 37 weeks, just a couple of weeks from meeting my baby boy, and so thankful to have not gotten COVID. I hope that me sharing that I got the vaccine and the booster, baby's doing great, I hope that can help other people feel comfortable with getting it too.
All of the doctors and researchers that I spoke with say it took a lot of collaboration and a lot of funding to get all those answers. They hope all of that stays in place so that they can be ready when the next pandemic comes. Jared Aarons, ABC 10 News.
If you have questions about COVID and pregnancy, we have some links with information for you on our website. And as always, medical experts say talk to your doctor before making any decisions that could affect your health.